A Valley doctor is describing some of his COVID patients in a pretty harrowing way. He says it's like they're drowning, Jared, without any water.
Andy says he's even seeing this in some younger patients, and he wants to warn all of us that the severity of this virus is not over. Here's Brianna Whitney.
He's calling it dry drowning for a reason, where COVID patients barely move, but their oxygen levels go soaring down. These are the most severe cases, but he's seen it firsthand this week.
My patient is younger, he's in his 40s, and doesn't really have many other medical problems. And here he is struggling to breathe in the hospital.
Dr. Andrew Carroll is hoping his coronavirus patient makes a turnaround, but describes what he and others are going through as dry drowning.
The reason I call it dry drowning is because these people are struggling to breathe, and they may be just treading water. But the moment they try to move or do anything, then their oxygen drops, almost like going underwater.
Dr. Carroll says it won't take much for oxygen levels to drop, maybe just even a few steps. But he says, as with drowning, sometimes they can't turn it around.
We'll flood them with oxygen. We'll give them tons, and yet their oxygen is barely keeping them, lucid. And eventually, if the disease is severe enough, the oxygen keeps dropping and dropping, even if we've got them on a ventilator.
That's when he says patients will go on an ECMO machine to try and save their lives by taking their blood out, pumping oxygen into it artificially, then pumping it back into their body. But he says often it's at this point when they have multi-organ failure. He says his patient in his 40s going through a dry drowning experience this week is a reminder it can affect any age. Brianna Whitney for Arizona's Family.